Good morning and Swadhika to everyone. I'm Renu Garg, Medical Officer for Non-Communicable Diseases in WHO Thailand. I'm really happy to be here today to talk to all of you about non-communicable diseases, which are the biggest killers today in Thailand as well as around the world. So I plan to speak for about 20 to 25 minutes. That will leave us 5 to 10 minutes for questions and answers at the end. And I believe that the slides will be shared with you. I will start with the global NCD burden and movement, and then move on to the issues in Thailand. And finally, what you as medical and public health professionals can do to help the cause. So to start with the global burden of non-communicable diseases. Around the world, there are almost 42 million deaths every year from NCDs. This is about more than 70% of all deaths. And if we put together all the deaths from communicable diseases and maternal and child health causes and any other cause, non-communicable diseases exceed all those deaths from all the other causes put together. Now, one might say that anyway, people have to die of something, so why not NCDs? But the issue is that many of these deaths, in fact, 15 million deaths from NCDs are premature. That is among people who are below 70 years of age. And these are the deaths that can be avoided and which are unnecessary. The situation for NCDs is not going to get better unless we do something. In fact, the current projections are that NCDs are going to continue to increase, especially cardiovascular diseases, stroke, and cancers. These diseases are on the rise, and the current trajectory is that they will continue to rise unless we do something about it. Globally, tobacco use is the biggest cause of preventable deaths. Nobody should have to use tobacco, but 1 billion people use tobacco, and this is one of the most preventable cause of death, both for cardiovascular disease, cancer, diabetes, and chronic lung disease. With the COVID situation, the problem of NCDs has become even worse. In fact, it's a dangerous cocktail of mix with COVID with other risk factors for NCDs. For example, smokers are 1.5 times more likely to have severe disease. Those who have a high BMI or are obese are at 7-fold increase in severe disease from COVID. So these are all the problem of pandemics. The COVID pandemic has made NCD's situation even more critical to be addressed on an urgent basis. The drivers globally are the globalization, trade, and aggressive marketing, and which is really driving unhealthy behaviors among the population. It's not the population, the people who can be blamed for that. It's the environment in which the food chain supplies and other environment which is making it the environment very unhealthy for the current and future generation, which are the main drivers for NCDs. So to recognizing this really serious threat from NCDs, the global leaders in 2011, almost now 10 years ago, a decade ago, got together at the UN General Assembly and made a declaration that to commit that they will address NCDs on a very urgent and war-footing basis. And these were the prime ministers and heads of states of various governments, in fact more than 100 countries that signed up the political declaration to commit to reduce NCDs in the countries. And following that, these 9 global targets were set out to address NCDs, to reduce the risk factors for NCDs by 2025. The overall target was to reduce NCDs by 25% by 2025. So it's called 25 by 25. But includes targets like reduction in tobacco use, salt reduction, hypertension, diabetes, insufficient physical activity, alcohol use, as well as to increase people who would receive health care for cardiovascular risk or to prevent heart attacks and stroke. So these were the 9 targets that were set out, and most countries around the world set up similar targets, including in Thailand. The value of preventing and controlling NCDs is very clear. We can save more than 8 million lives by 2030 if we can implement the proven cost-effective interventions for reducing NCDs. And this is going to be a huge saving in economic term. For every dollar that is invested, there will be a saving of $7 at least. So let me now move on to the situation in Thailand and what is being done here and how much progress we have made. So in Thailand, NCDs kill 3 out of 4 people, and there are almost 400,000 deaths every year from NCDs. That is almost 1 death every minute from an NCD. In fact, even in the last 1 year, from COVID, some around 85 people have died from COVID in Thailand. But most of those people who had severe disease and died actually had an underlying NCDs. So it is really critical to address this problem on a very urgent basis. So the pie chart here shows that 3/4 of the burden from all causes of death are from NCDs in Thailand, and the situation is just, it has been increasing in the past quarter of a century. It has really been increasing quite dramatically. These are the top causes of death in Thailand. Tobacco is the #1 cause, causing the #1 risk factor, causing more than 70,000 deaths every year, followed by high blood pressure, raised blood sugar, poor diet, air pollution, alcohol use, and so on. So these are the top killers, and most of these, as I will show you shortly, progress on most of these is not on track at the moment. This is the trajectory of deaths in Thailand for cancer. As you can see, the trend is increasing. Same way for stroke and ischemic heart diseases. So these are all preventable causes of death. If we can treat people with hypertension in time, if we can prevent the use of tobacco and alcohol and promote healthy diet, many of these deaths can be prevented, and we can reverse the trend of these increasing mortality. So this chart shows the trend in various targets. As I said, there are 9 targets, and if we look at the trend, 6 out of 9 targets are not on track for Thailand. For example, the overall target on premature mortality is likely to be missed at the current rate of progress. For obesity, the blue line is the current trend, but what we need to reach is this green target, and it's not going to be, we will have to reverse this if we have to reach this. But right now the target, the trajectory is that it is going up dramatically. Same way for tobacco, there is a slight reduction, but still not enough to meet the target. For hypertension, the trend is going in the opposite direction, and same way for diabetes as well. So these are all very serious issues that we need to do something urgently about. If we want to meet the targets, we will not meet them at the current rate of progress. This is the overall situation. You may know about the SDG goal of 3.4, which is to reduce premature mortality from NCDs by 1/3 by 2030. But if we look at the trend, we are not going to be able to meet that in Thailand. The target is here, but the projected is going to be above it. And out of all the 9 targets, most of them are not actually met. The only target which is on track is physical inactivity, and the one which has been achieved is to reduce, make NCD medicines available and treat cardiovascular risk. But if you note, both of these are in the health sector, whereas tobacco use, alcohol, the other targets require action from other ministries. And let me explain that a little bit more. So the point is that if we want to win the war against NCDs, then we need to work upstream. This is a sort of a comic from a story where at the bottom, at the downstream of the river, the health staff, the hospitals and the doctors and nurses are working very, very hard to save people who are falling in the river. But the more they work hard, they still can't cope up, because so many people are falling into the river from upstream, because there are so many risk factors that are being created. These are these illness factories, as we call it. Sugary food, salty food, tobacco, alcohol, processed food, and so on. And how much ever the medical staff and the hospitals work hard at downstream, the problem is increasing at such a rapid rate that they cannot keep up with it. So the solution to this is to stop generating these new cases of NCDs, which are being generated at the top by increasing risk factors. And what are those kind of actions that would be needed to upstream? So, for example, at the upstream level, what we need is, we need laws, we need fiscal policies like increasing taxes on tobacco, and we need to provide healthy food in schools and workplaces. And all of this is action by many ministries like Ministry of Education, Ministry of Finance, the legal department, and so on, and which needs to be coordinated at the highest level by somebody like the Prime Minister or his delegate. So this is the most important point, that the solution for NCDs is not going to be just by doctors. it will require very high level action by different ministries. Just like the COVID pandemic is being dealt at the very highest level by the Prime Minister's office, it is being coordinated from there. NCDs is another emergency just like that, and it requires that kind of coordination. For the health sector, the most important action is at the primary health care level, where early diagnosis of things like diabetes and hypertension is important, because these can be treated in a cost-effective way. But if we fail to do this, then the action goes downstream, and then we are facing in the hospitals people coming with heart attacks and strokes, which require ICU care or surgery, which is all very, very expensive and not at all cost effective. So the point is, best to avoid these risk factors by high level coordination and commitment from other ministries. And next best action is to take care of these issues when they are at the beginning at the primary care level. So these, this slide lists some of the WHO recommended best buys, and these include, you can see the red is all about regulation, including fiscal policies like taxation, plain packaging, marketing control, and so on. And the blue ones are changing the environment. For example, we can reduce the salt and sugar in the food, in the packaged food, through reformulation, and we need the cooperation of the private sector and the industry for that. So this slide lists all the cost-effective interventions that can be used for preventing and reducing the burden for NCDs. Again, to make the point that the upstream action is required from the highest level, from all of government and all of society, by different ministries, like Ministry of Education, Finance, Interior, and so on. And the health sector's role is more midstream and downstream for early detection and treatment. Again, the same point that we need multi-sectoral action for prevention and control of NCDs from the government ministries, from civil society, from the academic sector, from the universities for research, from the UN agencies, and from the media, and from the whole of society, if we want to really make some progress on NCDs. So coming to Thailand, the 3 top priorities for Thailand, if we want to get back on track to achieve the targets. Number 1 is aggressive tobacco control. And this must be done through increasing tobacco taxes, both on cigarettes, but especially on roll your own tobacco, which has very low tax on tobacco in Thailand. The second is removing the tax tiers. Thailand has introduced tiers on tobacco, which makes it harder for, which is a regressive policy in many ways, and that those should be removed. Enforcing laws better. Thailand does have good tobacco control laws, but they need to be enforced in order to be effective. And to increase access to nicotine replacement therapy. Right now we have more than 10 million people who smoke in Thailand, and we need to offer to them nicotine replacement therapy. This should be included within the UHC package to be offered more widely. And that will help to reduce some of the chronic smokers to quit tobacco. And finally, to accede to the WHO FCTC protocol to eliminate illicit trade of tobacco products, because it makes the taxation more efficient if Thailand accedes to this protocol. And many countries around the world have already acceded to this protocol. The second most important action for Thailand is salt reduction, because salt reduction can help in reducing hypertension and reduce the risk of stroke and ischemic heart disease, and also kidney disease and other problems. So again, there are a number of policies that can be used, taxing the excessively salty food, imposing maximum levels of sodium in the packaged food, adding front of pack labeling, warning labels, restricting marketing of unhealthy foods to children, and in school and workplaces, as well as conducting public awareness. I think we need to do more on all of this, and this will yield great returns in terms of investment. It is one of the most cost-effective interventions to, if we can reduce salt gradually over a period of time. And in Thailand, like in many other countries, the consumption of salt is at least twice the recommended levels. And the third important thing is to control hypertension, to detect it early and to treat it with simple medications. And I just want to show you this chart, which is the level of the red part is the level of undiagnosed hypertension, and this is on the x-axis. You have the age group, so you can see that younger working age people have a lot of undiagnosed and untreated hypertension. And this is the group that we need to catch early and treat them, because if we can control the blood pressure, that greatly reduces the chances of stroke and ischemic heart disease, and it can prevent many premature deaths. So this is a real priority, but many of these people don't actually show up in healthcare facilities or primary health care because they are working and they don't. So I think we need to work towards making services more accessible, especially to the working age group. So here I've listed a few of the challenges that come in the way of prevention and control of NCDs. Political inertia is one of them. The kind of political commitment that we have seen for pandemic response, if it was there for NCDs, I think we could make a lot more progress on NCDs. The second big challenge is industry interference. Even though when policies are made, whether it's for tobacco, alcohol, or even food policies, there's a lot of interference from industries to dilute these policies. And I think we need more cooperation from the industry, especially from the food industry, to improve the food supply chain in Thailand. The other problem is the ownership and accountability by other ministries. As I explained, NCDs require action by other ministries, but it is usually seen as a problem of health ministries. As we can appreciate, health ministry can only treat people who are sick and to some extent create health promotion, but action to impose taxes or legislation must come from other ministries. So just to summarize, my key messages are the NCDs are an emergency and they must be treated as the emergency they are. It is time to really recognize that we have to address NCDs on a war footing basis. Second, Thailand is lagging behind on its NCD-related targets and global commitments, and we will need to do more if we want to meet these targets. Third, the war on NCDs will not be won by clinical clinicians or clinical tools or by health sector alone. We need action from many sectors, from other government ministries as well as from the society. We need upstream action if we want to win the war against NCDs. Fourth, we need a whole of government and a whole of society response to NCDs. And finally, the fifth point, we need champions. In Thailand, we've made a lot of progress in many areas, one being the universal health care coverage, and we had great champions for that. And I would, since you are all in public health and medical field, I would urge you all to become a champion in any cause that you feel deeply about. What are the qualities of a champion? Champion is someone who's deeply passionate about a cause. It can be anything that you may take up tobacco control or promoting healthy diet or whatever appeals to you, or physical activity. So you can take up any cause, anything that you're passionate about. It requires a lot of courage. Champions are very courageous. They are fearless. They are not afraid to say what they want to say and do. They are relentless. They are unstoppable. They do not stop till they meet the goal. They are movers and shakers. They are accelerators. They increase momentum. And they are compulsive, almost to the point of being fanatic, where they take up a cause and they don't leave it. They go after it with all the passion and energy they have. So those are the qualities of a champion. And what the champions do is that they advocate for policies. They strategize how to keep the work going forward. They create momentum, and they use facts to negate anything that is affecting the cause. They are very persuasive communicators, and they are role models. They follow what they preach. So these are some of the qualities of champions and what they do. So I would urge you, whether you are already working, practicing clinician, or you are an emerging public health professional or a medical professional, take up a cause and be a champion for that cause, and that can greatly help to accelerate the movement on NCDs. Even let's not underestimate the power of one. Even one person can make a difference. In fact, any great movement starts with one person. So that is what I would urge you all to be. So I will stop here, and I'm happy to answer any questions if we have some time. Thank you so much for a patient listening.
Okay, thank you. Thank you very much, Dr. Renu, for your very influential talk. So yeah, we can see that Thailand is still just right there, far away from the target, from the global WHO NCD target. So if you have the just right this year, what is your suggestion or your advice for the government that should the government do for the priority for this year that you would suggest to get we back on track to the target for the NCD?
Yeah, excellent question, Dr. Sombat. I think the priority this year, especially more than any other year, would be one to aggressively address tobacco control, because we see all the NCD risk factors like tobacco use and can increase the risk for severe disease for COVID. So it is a very good time for people who smoke to quit smoking. And I think this would be a very good year for the government to introduce policies to help people to quit smoking by introducing nicotine replacement therapy into the universal health coverage package. And it's a very good time to, it's really important to increase the taxes on tobacco. Tobacco is actually taking away money from people. You know, the economy, it is people who smoke spend a significant proportion of their income on tobacco use. So by increasing tobacco tax, it will be a discouragement for people to smoke and to reduce smoking. That is, in fact, the most cost-effective, most important policy for if we want to reduce tobacco. So I would say increase the taxes on tobacco, introduce, make nicotine replacement therapy more accessible, and improve the food supply by restricting marketing, and making people more aware so that there is healthier adoption of healthier behaviors.
Okay, thank you very much, Dr. Renu, for your very informative talk and your answer that would help us to get back to our track to cope with the NCD. I think the NCD is the huge problem. It's not just like only just 1 or 2 years. It's maybe more than that. If you compare to the COVID, it's pretty much not just like the pandemic, but it's just like endemic in the area already. Right. Thank you again.
Yeah.
Dr.
Thank
Renu.
you very much.
You're
Thank
welcome.
you.